induce modification. But as soon as you don't touch it, at the moment, you just look, right? So we look before. And again, I can look over there that here, the clavicle, the collarbone here, is more prominent on the right side compared to the left one. And I can see that also because of the muscle around and the tension there. The scum, sternocleidomastoideo muscle here is more tender on the left side. I can see it from here. So here something happened there. Okay, so here C0, that means occiput, and C1 on the left side, it's stuck. I mean, the motion doesn't appear normally. So, yes, here I need to do something here on the left side to release that compression. And remember the TMJ here is more sensitive around this. So. And the cervical spine here, C3, C4, C5 on the left side the same. Trouble here. So, alright. So what you could do in that issue first, you can use the technique I showed you already. So that one, press, give some traction. You can use that one, flexion, extension. You can use that one, gapping technique to open the space. So you can use that one in that case. And I'm going to do that, same.
Sir, in that case, is that in that particular case, the leg length also affected?
The what?
The leg length.
The legs. You mean if there is a shortened one? Or?
Yeah. Shorter and then is there affected also?
Yeah, I mean, for the posture, everything is involved. But again, with the short leg issue, we are not quite symmetrical. And it's very common to have like between 9 to 12 millimeters difference in between the two legs. Most of the people have this kind of problem. So no need to put something on the shoe, like insole or something. It's bullshit. We deal with that all the time. And about the shortened leg or longer one. Again, before to say anything, you have to test the joint, pubic joint, A-side joint, check the hip joint, and see if it's quite normal. And then you can do your test and see if there is a shortened one, yes or not. So you can see anything before you're doing your assessment on the pelvic joint and the hip joint and see if everything is fine. We can ask the question also if she get braces when she was young. No braces. Okay. What about the wisdom teeth?
She had extraction.
So you got it already. The fourth one.
The last
Yeah.
That was when she had a lock.
Okay. can give also some nice traction and release from here. From here, traction, gentle. Here. Can move the occiput on the first vertebrae. Flexion here, extension here, flexion here, extension here, and I can see if during that motion the condyle are moving back or not. Remember, when you do that technique, I don't want to see this. I want to see that. But here, open. You don't have any headache, migraine, any nausea, any dizziness?
Only sometimes.
Sometimes. What about the blood pressure? No blood pressure? She has no blood pressure. She's flat. How much? Roughly.
100 and
Normal, 120 over 80.
When somebody say normal,
Sometimes 110, 120.
you ask the question, but what is normal for you? And then you can have some different answers. Somebody can say, for him, normal is like 14 over 12 or 11. But because he's 50 or 55, which is quite normal. 55, 14, 140 over like 9 or 10, it's quite normal. This is not high blood pressure. It's very basic. You know what I mean? So the normal means you have to ask a question about what is normal. Okay, so let's start to move a little bit the joints. So at the moment, if I do a basic test for muscle tone, I can tell you that that arm can't resist my pressure if I push down. That arm can't, they can resist. So when I'm going to ask her to resist and I'm pushing down, this one be effective, can resist. That one can't resist. I'm pushing down, she resists, no problem, right? Good. I'm pushing down here, resist, resist. I do with one finger, I can do that. Resist, move. If I do here the same, resist. You know what I mean? Strong. Here. If I stay here, let's go. But here, if I do that, resist. You know what I mean? Okay, so I'm going to release the problem here on the top, and then it's going to change. So you can do also that one if you want. Remember that one? Shifting here, shifting here. So first I'm going to inform the tissue that something going to happen. So soft tissue technique first. Gently, softly. But that junction between the head and the neck is an old one. It's a whole story, you know. So sometimes things are here since like the very beginning of the story. That means since the delivery. because the baby sometimes has some trouble to take the head out normally. So he compresses one side compared to the other one, and then that side still compressed during their whole life. When you see people maybe at 40 years old or 30, the compression is still there. So it's a whole story. So then I remove the skull upon the C1. Resist. Strong, still strong, no problem. The other one. Resist. What's gonna happen?
Strong.
Become stronger. She can resist now. She has changed a little bit the item there. If I press, she can't. Now it's quite okay. We keep going. So C0, C1 left was now okay. So you can move both sides normally. What about the TMJ here? Here I need to do some work over there because I know that that side is suffering. So again, you can use 2 fingers is enough for that joint, and gently here you can release a bit of traction over there. You can give some nice decompression there. Get some contact here with your chest and moving the jaw opposite side. We saw that the jaw is deviated to the left, so we have to contact point here to see if it's open or not, and then you can give some traction here, gently. Open the space over there. Here. You can also move down the mandible, pressing down with your both fingers here, here, here. Remember the neck. The neck also is in suffering. So you can do that one also here. This one you can do here. You can do that one also here. Okay, C4, C5 on the left side. Now it's more loose here. The meaning with the joints, when the joints are how to say that, stuck, you need to, in that kind of technique, you need to first release the muscles around, and then you need to move the joints, and then you need to fix the joints if they are not balanced. But you need to follow that pathway. If you just want to assess the joint before to release and move the muscles, it doesn't work, and it's bad for the patient. Okay, could you take a seat, please? Turn back here. So remember, C7 have a big spinous process, C7, more than the other ones. And then you have T1 just close to C7, right? So these two are C7 and T1 here. And the problem is more like on C7 on the left. Okay. Okay, so I'm gonna check the pelvis. So you can, if you have time in your office, you also can on the SI joint, on the junction between the ilium and the sacrum, both sides here, and ask to your client to breathe in, breathe out. And you're going to see the sacrum moving up and down. And sometimes, because it's locked from one side or compared to the other one side doesn't move up or down, it's locked. And you're going to feel only on one side up and down. Give some traction and release here to make the joint under traction there, and I press here just to feel if it's open or not. So using my body weight again, and give some traction there. On your right side, face to me. Good. Good. Take a seat. Anything different, yes or not?
Big difference.
What the big difference is?
Like more balance.
So, Doc, so she needs to change a little bit of her lifestyle. Because if she will do again her ways, could that be back again? Or what do you think?
This, I mean, we just provide a small session today to fix the basic one, right? But of course, we need to go deep into the treatment if you want to do something in a long-term treatment. But the meaning is it's more like these issues are more like connected with the. For me, are connected with the head. For me, it's coming from the top, and then go down. All the compensation for me, like now, for me, it's coming from the top.
From the top.
Yes, that's the reason I start from the C0, C1, and then coming down to the neck over there, doing something on the jaw, and then doing something on the cervical spine, and then coming down to the SI joint, and that's it. And see how she will feel or not better after a while. So that will be the kind of treatment I can provide in the first level, at the first level. And then usually I see the patient like 1 week later, 1 week or 10 days later, and see if it's still balanced or the things are moving back to the previous state or not. So that's the meaning.